Welcome to the Bariatric Surgery Information Session for Lawrence General Hospital. During this information session, we will review the diagnosis of morbid obesity, the different options for bariatric surgery offered at Lawrence General, as well as the necessary follow-up care needed after surgery. Let's start with discussing morbid obesity. Morbid obesity is a diagnosis based on a disease of excess body fat. Obesity is multifactorial and often genetically related. It is often associated with multiple comorbidities such as high blood pressure, diabetes, and sleep apnea. You have a diagnosis of morbid obesity if your body mass index, or BMI, is greater than or equal to 40, which puts you approximately 100 pounds overweight. Body mass index, or BMI, is a measurement of your weight in relation to your height. BMI can be calculated using this equation. As you see here, someone who is 5'6" and weighs 250 pounds has a BMI of 40. Take a moment to calculate your BMI. These are statistics related to obesity in the United States. Note that obesity is the second leading cause of preventable death, only behind tobacco. Obesity is a metabolic disease, meaning it can lead to many other systemic health issues, including diabetes, pulmonary disease, and even increased risks for cancer. This slide is showing the resolution of medical conditions after one has had gastric bypass surgery. Note that type 2 diabetes has a 95% resolution with gastric bypass. There are also dramatic improvements in high blood pressure, cholesterol, and reflux. Many people ask themselves if surgery is really necessary for them to lose weight. For the majority of those people, the answer is yes. We have found that diet and exercise are not effective long-term for the morbidly obese. We have also found that the benefits of surgery far outweigh the risks of staying morbidly obese. The National Institute of Health released their consensus statement on bariatric surgery and reported that permanent weight change is almost impossible for the severely obese by means presently available, with the exception of surgery. They also stated that surgery is an accepted and effective approach that provides consistent and permanent weight loss for morbidly obese patients. The National Institute of Health also made recommendations for who would benefit from bariatric surgery. They recommended that those with a BMI of 40 or over, or those with a BMI of 35 to 39 with significant comorbidities would benefit most. They also recommended that people should have trialed a medically supervised weight loss program before. The surgery should be performed by a multidisciplinary team, and patients should be committed to lifelong surveillance. In order to qualify for surgery, you must ensure you meet National Institute of Health criteria as previously discussed. You must also be free from drug or alcohol abuse, and you must not be smoking. We will now discuss the two surgical procedures offered at Lawrence General Hospital, the Roux-en-Y gastric bypass and the sleeve gastrectomy. First, let's review the sleeve gastrectomy. With the sleeve gastrectomy, you can expect to lose about 60 to 70% of your excess body weight. This procedure will remove about 85% of your stomach, restricting the amount of food that you can eat. Your new stomach will be about the size of a banana. There is no bypassing or rerouting of intestines with this procedure. With the sleeve gastrectomy, there is still a question of whether or not dilation of the stomach can occur over time, causing weight regain. Long-term data is still not yet known. let's review the gastric bypass. With this procedure, you can expect to lose about 70 to 85% of your excess body weight. Your new stomach is about the size of a golf ball, and your intestines are rerouted, increasing weight loss through malabsorption. The gastric bypass is the gold standard procedure for bariatric surgery in the United States, including the longest and most thorough follow-up. One possible disadvantage you may experience with the gastric bypass is something called dumping syndrome, which causes you to feel sick when eating high-sugar foods. Results of bariatric surgery obviously include weight loss, but more importantly, a reduction or improvement in comorbidities. Bariatric procedures performed at Lawrence General Hospital are all laparoscopic procedures. You can expect to have 5 small incisions at the end of your surgery. Advantages of laparoscopic procedures include fewer wound complications, less pain, and faster recovery. Laparoscopy also allows the surgeon to have a better view of the anatomy. Some take-home points to remember from this presentation are that bariatric surgery is not a cosmetic surgery. No one procedure is better than the others. We want you to choose which procedure you feel most comfortable with and which you think would benefit you the most, and that the surgery is really only a small part of the process. The success of the surgery is really up to you. Now let's discuss what you can expect after surgery. Immediately after surgery, you will be following up frequently with your surgeon and with your dietitian. On average, you'll be following up approximately every 3 months for the first 2 years, and then annually thereafter. We recommend that you do not get pregnant for the first 2 years following your bariatric surgery. Prior to being approved for surgery, you must complete several consultations and preoperative testing. Once you review the information session, you can be scheduled with the nurse practitioner for your initial evaluation. At this appointment, we will then schedule your consults with the psychologist, dietitian, and your surgeon. You will also have to complete support groups and receive a medical clearance for surgery. Thank you for reviewing the bariatric information session at Lawrence General Hospital. If you have any questions or if you'd like to schedule an initial evaluation with the nurse practitioner, please call our office at 978-946-8450. Thank you.